Today, there are 14,785 active cases of COVID-19 in Alberta. That number continues to decline as we've had 1,548 recoveries, but 879 new positive tests. That is on just over 11,000 tests for a positivity rate of 7.7%. 890 Albertans are in hospital with COVID-19, of whom 153 are in intensive care. Sadly, 26 more Albertans have passed away, meaning that 1,028 Albertans have lost their lives to the COVID-19 pandemic since it began in the spring. Earlier this month, let me pause to say I'm sorry again that, as I did in my statement yesterday, our condolences go out to all of the families of those whose lives have been lost to the pandemic. Earlier this month, it was my pleasure to announce the arrival of 25,350 doses of the Pfizer vaccine to Alberta. And today I have more good news to share, now that the Moderna vaccine has received Health Canada approval. Today, 16,900 doses of Moderna vaccine will arrive in Alberta and will immediately begin immunizing residents at long-term care and designated supportive living facilities. The first shipment will arrive at facilities in Edmonton, Calgary, Red Deer, Medicine Hat, Lethbridge, Grand Prairie, St. Paul, and Fort Saskatchewan. This is exciting news for staff, residents, and families of these facilities who have been on the front lines of our battle with COVID-19 since the spring and who have experienced untold pain and loss. As more shipments of both the Pfizer and Moderna vaccines arrive in early January, immunization will focus on residents of long-term care and designated supported living facilities, followed by seniors aged 75 and over, and First Nations on reserve, Inuit and on-settlement Métis individuals aged 65 and over. Immunization of respiratory therapists, intensive care physicians and staff, and long-term care and designated supportive living facility workers across Alberta will continue. In fact, by the end of today, Alberta Health Services will have administered over 7,000 doses of vaccines to frontline healthcare workers. I know Albertans are keen to hear more about when the vaccine will be available more broadly, and I want to assure you that we also want to provide you with that certainty as well. But I must ask for patience as we await the first regular shipments of both Pfizer and Moderna vaccines. We are still on track with the phased approach that I outlined earlier in the month. Over the coming weeks, we'll see vaccines continue to be offered to respiratory therapists, to healthcare workers and in intensive care units, to staff in long-term care and designated supportive living facilities, and we'll be expanding our efforts to get vaccine into the hands of healthcare workers in emergency departments. And most importantly, we'll be reaching residents of LTC, that's long-term care, and designated supportive living, regardless of their age. Well, in fact, we directed AHS to use New Year's Day to schedule appointments this morning, and when I learned that that had been scheduled as a day off, we obviously understand the huge healthcare workers are under, and many of the vaccines are delivered through community partners who normally would not operate on Christmas or New Year's. But our direction to AHS is to treat the administration of the vaccines as an emergency. Every day that we waste is ultimately going to represent lives lost, and we should be using every available working hour to administer vaccines. So I understand they took more time off in Ontario. That I understand that they simply didn't book vaccines on Christmas Day here because it was very difficult to get staff. But I hope that we will be working as close to around the clock as possible. I can tell you that in our cabinet conversation this morning, one of our ministers referenced a model of Israel, which apparently has the most efficient vaccine administration program in the world, and they are literally scheduling vaccinations 24/7. I'm not sure that we'll be able to get to that given the community partners that we depend on, but we have certainly conveyed a sense of urgency. This is obviously a case of, as Dr. McDougall just said, all hands on deck, and we should be using every day, 7 days a week, to administer as many vaccines as possible. That's the message that we sent today.